All right, I'm Dr. Gerard Adler. I'm an orthopedic surgeon and sports medicine specialist at the Aurora Wilkinson Clinic and the Aurora Medical Center in Summit. I also am the medical leader of our Aurora Sports Medicine Institute here at Summit. I want to talk about a patient that I had the pleasure of taking care of. His name is Bob Evans. I met Bob back when he was in high school. And Bob was a very good athlete and basketball player and played his basketball at Catholic Memorial. Bob had a right knee cartilage problem that subsequently was interfering with how his knee was functioning. So we did an outpatient knee surgery to help stimulate the repair of the cartilage, and Bob had a very good result and was able to finish his high school career. Bob then went on to play college basketball at Michigan Tech, and as he was training the summer, I believe prior to his sophomore season, Bob then dislocated his left kneecap, so his other knee. And when the kneecap, I have a knee model here, that when the kneecap pops out of joint, which happened when Bob was playing basketball, it caused a joint cartilage injury to the outer part of the femur or the thigh bone, as well as off of his kneecap. So we took Bob to surgery within a week of this because he needed to get back up to Michigan Tech to go to school and start training for that basketball season. So during his surgeries, we did this with the surgical telescope or the arthroscope. We then smoothed out those cartilage lesions, and then we had Bob start in physical therapy and gave him a patellar stabilizing brace. I then talked to Bob's coach and integrated his care with his athletic trainers and therapists back at Michigan Tech, and Bob was able to get back to playing some time on the team that fall already, and really was back to playing full-time basketball really by about 3 months after his surgery, so he had a fantastic result. I hadn't seen Bob then through the latter part of his college career, which was good because it meant that he was out playing basketball instead of coming to see me. And he then went on to, after he graduated from college, he was a teacher up in the Upper Peninsula. And Bob then, I did see him again in 2010, and he was starting to get into some alternative sports. One of those was unicycling. So he was on a mountain bike trail unicycling in Colorado, fell and broke his collarbone or clavicle. So I had a chance to catch up with Bob, and at that point his knees were doing great. The knees continued to do well, and so well in fact that he started to both run and juggle, or a new sport called joggling, and so he went on to then continue his joggling career and was so successful that Bob has now set the world record in the 5 and 10K events in men's joggling. So Bob attributes his excellent results and being able to become a world-class athlete and world record holder due to successful knee surgeries that he had back in his high school and college careers.